Hi Jerome and Nabil, thank you very much for talking to Psych Scene Hub. I'm sure the audience is going to be very pleased to get some of your insights on how you passed the OSCE. So to start off, what was the experience like?
It's a great experience, feeling that, we have finished the exams, both the writtens and the OSCEs. Obviously, this is a big stressor for every trainee, to finish the exams, and glad that, Nabil and I have completed both of them now.
Yeah. And both of you obviously are very much towards your latter stages of training. Nabil, you're an advanced trainee in consultation liaison psychiatry, and Jerome, you're advanced trainee in forensic psychiatry, and obviously the unique distinction of having gotten through your OSCEs first time around, which is always excellent. So obviously very, very valuable insights that you will have for other trainees as to how to pass it. So what about your insights, Nabil? I mean, what was your experience like in terms of preparation for the OSCE?
I mean, we can talk about it now. At that time, it was quite stressful. I mean, looking back at it, glad that we passed it in the first go. I think the most important thing what I did was need to have a clear timeline that so I had 6 months in my mind that I'm going to prepare it for 6 months. I divided it in two ways. The first one was short stations and long stations, and the other one was according to the themes. So I did the Psych Scene videos, all of them, and I actually did them in that sequence as well, that these are short stations, these are long stations, and if they are short or long, what are the themes? I did anxiety as a theme, depression as a theme, psychosis as a theme, then forensic, child and adolescent, psychotherapy. So these are the broad themes, and the last one, which is quite important, and I think most of the exam had it, was a consultancy viva. So these are the themes, I think, which I divided, and I had a study group, which that is really important.
Helps,
it really helps that because you kind of see how other people interview styles are, and then you kind of pick from them as well, and you can tailor your own interview styles, because it's 8-minute station, the short one, and then you have to perform, and you have to have some buzzwords and some buzz questions as well. So that's how I prepared. So I had them. So for example, for personality stations, I had some buzzwords. For this personality, I'm going to ask this question as a screening. And for depression, I'm going to ask this. Anxiety, I'm going to ask this. Panic attack, I'm going to ask this. So this is how, so I had all them, and I kept preparing. And in the study group, I actually was timing myself and just prepare. And I did also a lot of mock exams.
And I think what you're highlighting here is the importance of practice and having a checklist, obviously, but not letting it come out as a checklist.
Oh, definitely.
And then practicing. Was your experience similar?
I mean, obviously, study groups are very essential, and it is you need to have study groups in order to pass OSCEs. With the written exams, one could get away without being in a study group, but with the OSCEs, it is a must. As Nabil said, it allows you to learn from others their own strengths, as well as what your strengths are as well. And with the new college requirements, so now the questions are at a consultant psychiatrist level. That's another challenge. Which what do you think, Nabil? Like, how did you come across like the transition? The past in the college, we're asking questions at a junior trainee level, and now it's in consultant psychiatrist level.
Exactly the same thing. I was actually thinking and putting myself that if in a real clinical situation, if this comes up, how will I react? So in that sense, because coming back at the time I was practicing for OSCE, I was working for acute care. So I was by myself. Of course, I had a supervisor, but my supervisor is not sitting there and seeing every single patient with me. So it kind of gave me that feel that this is how the exam's going to be like as well.
That's right.
And so I took it as not I took it like a real clinical situation every station, and I was practicing in that way.
And I think that's a very good strategy to use that clinical time, because really these are slices of clinical practice, the OSCEs. A common thing that most trainees tend to ask is the anxiety provoking aspect of the exam in a way. How did you manage your own anxiety? Jerome, What are the kind of things you did?
Every exam is anxiety-provoking. I think the more we get desensitized to it, like having lots of practice, attending mock exams, other ways to basically deal with the anxiety. And again, it depends on one's coping skills as well. How do they cope with their stress in general? At the end of the day, I feel that towards the latter part, especially when the exams are nearing, it's very important to believe in oneself. To be self-aware of their strengths and concentrate more on his strengths, and not to worry about oh, I haven't read much on these topics. These are not my strengths. Just to put them aside, focus on what your strengths are, and that's something what helped me. Towards my passing your scheme.
Well, that's great.
Yeah, I think I completely agree. The most important thing is to desensitize yourself. More practice you do, the more you kind of come into that mode, that the exam mode as well. And another thing which I'll add on is the set shifting. So during the practice, what I was doing was, if I didn't do one station well, I'll just try and forget about it and go on with the next station. Exactly in the exam as well. You've got a margin of a few stations. So if you haven't performed well in the first station, say, or second station, then you shouldn't be worried about it and should not carry that in the next stations. Because in the exam, there are two streamlines. One is the short station, one is the long station. So you've got a bit of a break between both. So kind of just go in that set that, okay, I'm going to do say, for example, you get the short ones first. If your first one was not so good, you still have got margin of 7 stations and 3 long stations. So I think that's very important. And I would advise all the trainees is that if you haven't performed well in 1 station or 2 stations, try not to take that in the next station and just focus on the next station and try and pass.
I think it's a challenge, as Nabil said, that is something what one needs to do, but it is an extremely difficult challenge. All this starts right from the beginning, for someone to be aware of what the real challenge is actually going to be on the day of the exam, compared to a mock exam, which is a bit different. So having that in the back of the mind, putting it aside, going to the next station, that's the way to go. And again, all that comes from practice.
That's exactly. I mean, it's a challenge. Exam is a real situation. You kind of, sometimes we say, no matter how much we say, it's still going to be stressful. But try and make it as less stressful as possible. And that only will come with practice. That's what we did. Didn't do anything more than that. We just practiced.
And I think that's an important thing to drum into candidates is that, reading takes you only so far unless there is that shift from the thoughts to the action, the implementation. It's very, very difficult to pass this exam. And I think in terms of anxiety, I mean, one of the things I often think about is that we know that anxiety can impair performance, and we know, for example, the Yerkes-Dodson's curve, a certain amount of anxiety improves performance, but then until a certain level, then it can just dip down if it exceeds. And I think expectations and managing expectations is, I think, a very, very important thing about the OSCE as well. The aim is to be good enough in all stations rather than to perfect every single station. And what happens is the desire for perfection sometimes can create anxiety, which can impair performance. So understanding that, I mean, we do this in clinical practice all the time, but applying it to ourselves as well, I think is very, very important. So managing expectations as well, I think is a really important thing. Any final tips from you to the audience?
I think passing OSCE is all about practice, having the self-confidence in oneself, and people have gone through it, people have passed, and exams are meant to be passed, so I'm sure with continuous practice and some dedication, ongoing preparation, one should be able to pass the exam.
That's great.
I would agree. I would just say practice. Practice and try and learn from other people as well, and come up with your own. Everyone has got their own style. My one final thing which I always said is be yourself in the
Yeah.
exam. Don't try to be anyone else.
That's right.
Just be yourself, what your interview style is, the way
Yeah.
you have practiced for as many years you're working.
Yeah.
Just stick to that and perform in the exam according to your own strengths.
That's great. Thank you very much
Thank
for
you,
your
sir.
insights.
Thank you, Sam.
So there you go. I think some really valuable insights from Nabil and Jerome. As they say with real estate, location, location, location. With the OSCEs, I think it's practice, practice, practice. And you'll be seeing much more of Jerome and Nabil on the upcoming psych interview videos, where practical insights will be imparted. And of course, they're obviously a key part of the Psych Scene team as well for future development of the courses. So thank you very much for listening. Good luck with the exams.